Welcome back to Stay with Trends. Today's topic is Top 15 Viruses that Kill Humans Without Having Vaccine to Cure. Humans are struggling from viruses since before our species had even evolved into its modern form. For some viruses, researchers innovate vaccines and antiviral drugs to keep our health safe without spreading throughout in our body. Also, some vaccines help to recover forever. The best example is smallpox vaccine. It completely eradicates and does not make the virus to enter again. Most of the viruses are transferred from animals to humans and triggered huge outbreaks, claiming thousands of lives. Let's see the top 15 deadliest viruses, one by one. Let's begin. Number 15. Smallpox. This sort of virus, which causes smallpox in our body, and washed out nearly hundreds of millions of people in the world. As you know well, this virus comes from animals, but we should not blame only animals. This sort of virus can also comes from human activity, as they get contact with each other, like corona situation now. There are several types of smallpox disease that even kills humans. If a person affected by this virus, it offers symptoms like fever, rash, and blistering. As a result, the oozing pustules that develops on the skin. At last, this smallpox virus can be eradicated with the help of vaccine, which was established in the year 1979. Number 14. Dengue. The leading cause of the death in all over the world is this infection. The symptoms we can feel are high fever, severe headache, and, in the worst cases, hemorrhaging, which means rapid loss of blood. The good news is that, if a person had this virus, you can freely talk to them and make a close contact, because it cannot be affected from humans. But the bad news is, still vaccine is not identified, and we can easily get bite from mosquitoes without any expectations. The CDC estimates that there are over 400 million cases of dengue infection, and also 100 million people suffer symptoms each year. Number 13. SARS, CoV-2. This virus belongs to a same family as SARS-CoV, known as coronavirus. This virus was first identified in December 2019, and it still continues. It was first affected in Chinese city, Wuhan. It was identified that the virus was originated from bats, like SARS-CoV, and affected all sorts of animals, before getting into humans. After that, it started to affect people, which ranges around tens of thousands of people in China, and worldwide. So, this occurrence made quarantine all over the world to restrict travel nearby cities, which was ordered by government authorities. It is also called by another name, which is COVID-19, and it has estimated a death rate of around 534k people till now. I think death rate may increase because of not having vaccine. The symptoms are fever, dry cough, and shortness of breath, and the disease can progress to pneumonia in severe cases. If a person has strong immune power, will survive. And the above estimated death rate mostly comes for older people who don't have strong immune system. Number 12. SARS-CoV. The same as that of SARS-CoV-2, and it was first established in the year 2002, in the Guangdong province of southern China, according to the WHO. After started affecting to China, SARS affected in 26 countries around the world, and around 8,000 people are affected, 770 people are dead, over the course of 2 years. SARS has an estimated mortality rate of 9.6%, and as of yet, has no approved treatment or vaccine. Number 11. Lassa Virus. This virus is carried by the species of rats in Western Africa, called Mastomys natalensis. Humans, however, can only spread it through direct contact with bodily secretions. Lassa fever, which has a mortality rate of 1% among hospitalized patients, the rate is from 15 to 50%, causes about 5,000 deaths a year in West Africa, particularly in Sierra Leone and Liberia. And deafness is its most common lasting symptom. It starts with a fever and pain behind the chest, and can progress to facial swelling, encephalitis, mucosal bleeding, and deafness. It is also said that 80% people who are affected by Lassa virus has no symptoms, according to WHO. At last, researchers and medical professionals has found a successful result for treatment of Lassa virus with an antiviral drug. Number 10. Influenza. This virus is also called as flu. There are different sorts of flu around the world. According to WHO, up to 500,000 people around the world died because of illness. If the new flu occurs, the higher ratio will be seen in mortality and spreading of diseases. The most deadly flu comes for Spanish flu, killed around 50 million people in 2 years, and infected 40% of the world's population. The swine flu, which occurred in 2009, and made a death rate of around 100,000 and 400,000 people around the world in just 1 year. Influenza can be affected easily, and the treatments are produced with the help of vaccine. The first affected zone is respiratory system. Number 9. Hantavirus. Hantavirus pulmonary syndrome, HPS, first originated from US in 1993. Firstly, this virus was identified from the young man with his fiancée living in US, and they died within a day because of this infection. After a few months, researchers and medical experts identified that it was carried by rodents. More than 600 people are affected by this virus, and around 36% of people are died from the disease, according to CDC. This sort of virus cannot be transmitted from one person to another. It was affected only from rodents, by making close contact. In earlier days, this type of hantavirus caused an outbreak in 1950s, during the Korean War. According to 2010 paper, in the journal Clinical Microbiology Reviews, more than 3,000 troops became infected, and about 12% of them died. Number 8. Japanese Encephalitis virus. This is the most frequent virus, which causes humans more, and this virus is generated from mosquitoes, especially from Asian countries, which results about 68,000 clinical cases every year, according to WHO. In fact, 24 countries from Southeast Asia and Western Pacific regions have this sort of virus infection, and putting over 3 billion people at risk for infection. The symptoms, which includes fever, neck rigidity, altered consciousness, headache, tremors, and convulsions. The death rate is about 30%, and infected people are around 30% to 50%. These infected people are suffered from neurologic or psychiatric sequelae. Mostly, this sort of virus comes from mosquitoes, which settle in rice field, and reservoirs include water bird and pigs. Still, there is no vaccine to cure this disease. Number 7. Hepatitis. There are 5 types of hepatitis exists, which includes Hepatitis A, B, C, D, and E. Around 96% of death rate are evolved in hepatitis B and C. Rather than using vaccine, people used to get a diagnosis because of limited access to affordable hepatitis testing. According to WHO, only 9% of people with hepatitis B and 20% with hepatitis C have received a diagnosis. When comes to overall infected people, around 325 million people are infected, which means around 4.4% of world's population gained this infection. Around 1.75 million people are affected with hepatitis C every year. Most of these deaths are due to chronic liver disease and primary liver cancer. Number 6. HIV or AIDS. At the end of 2019, around 38 million people are living with HIV. In the same year, around 90,000 people died from HIV, and 1.7 million people were newly infected. Since researchers introduced HIV for first time, it was estimated that about 32 million people are dead around the world, according to WHO. In the year 2019, 68% of adults and 53% of children living with HIV worldwide were getting treatment with the help of ART, which means antiretroviral therapy. But the majority comes to pregnant and breastfeeding women, which undertake around 85%, and they had this ART treatment. So, this therapy not only helps women, but also prevents newborn babies without affecting HIV. This treatment makes people to live longer with HIV. Number 5. Rabbies. Rabbies has a historical story, dating back to 2300 BCE in records of Babylonians, who went mad, and died after being bitten by dogs. This virus is like a beast, but it is curable, if the treatment undertakes immediately. There are different types of vaccinations occurs, sometimes getting injected in abdomen, with huge injection. If we do not care much about the treatment, the virus attacks the central nervous system, and death usually results. The symptoms such as delirium, hallucinations, raging, and violent behavior in some cases. Also, skin looks similar to zombies. Number 4. Rotavirus. This virus is mainly affected to babies and young children, which leads a cause of severe diarrheal illness. The virus can spread rapidly through what researchers call the fecal-oral route, meaning that small particles of feces end up being consumed. This virus majorly affects in developing countries and rarely attacks in developed nation. According to WHO, it is estimated that around 453,000 children are died from this virus, especially children who are all younger than 5 years, in the year 2008. Finally, researchers innovated vaccine, which helps to cure children, and declines the death rate and infection. Number 3. MERS. The name MERS comes from Middle East Respiratory Syndrome, which caused severe damage in Saudi Arabia in 2012, and again in South Korea in 2015. This virus belongs to the same family as SARS-CoV and SARS-CoV-2, which we saw in the top 12 and 13. Originated from bats, and before passing into humans, it infects camels. The symptoms, which come across by humans are fever, coughing, and shortness of breath. It has an estimated death rate between 30% and 40%. Still, there is no vaccine treatment to cure this disease. Number 2. Ebola virus. The first known Ebola outbreaks in humans struck simultaneously in the Republic of the Sudan, and the Democratic Republic of Congo, in 1976. Ebola is spread through contact with blood or other body fluids, or tissue from infected people or animals. The known strains vary dramatically in their deadliness. Elke Mulberger, an Ebola virus expert, an associate professor of microbiology at Boston University, told Live Science. One strain, Ebola restin, doesn't even make people sick. But, for the Bundibugyo strain, the fatality rate is up to 50%, and it is up to 71% for the Sudan strain, according to WHO. Number 1. Marburg Virus. This virus belongs to the family of Ebola, which is called filovirus family. In 1967, the Marburg virus was discovered to cause human illness by researchers in Marburg, Germany, who were exposed to infected monkeys imported from Uganda. Bats are thought to be the natural reservoir for the virus, but this has yet to be confirmed. The death rate is around 90%, and infected people are dying of bleeding into the gastrointestinal tract and skin, shock, disseminated intravascular coagulation, and multi-organ failure. The symptoms which cause humans are fever, headache, sore throat, myalgia, arthralgia, epigastric pain, vomiting, and diarrhea. There is no vaccine exists to cure this virus.